Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, we're going to be covering part 2 of nursing care for the hospitalized patient. We're going to be going over feeding the sick patient. We're going to be going over toys for the patient in the hospital, and we're going to be also going over fall precautions for the patient in the hospital. So this is part 2 of, I think it's going to be a 3-part series of caring for the hospitalized patient. Now, before we get started, as always, I'm going to ask you please to support me and support this channel by liking this video, give it a thumbs up, press that red notification bell so you'll be notified every single time a new video is released. And please don't forget to subscribe to my channel if you haven't done so already. Don't forget, guys, I am now offering next generation NCLEX reviews. You can go on my website, nexusnursinginstitute.com, to see my availability. And I'm also providing one-on-one tutoring sessions. Any question that you want to ask me, I have lots of students who just graduated and they have questions about what field, what arena of nursing they should go into. I have students that are currently in the program right now and they just really need to pass their next exam. And so they do one-on-ones with me to go over whatever, is going to be on their test. They don't know exactly what's going to be on the test, but whatever on their study guide. And I'll kind of explain to them the most important things that they need to know. And I will really point out the most important things that you have to understand. And my one-on-ones are booking fast. If I'm not mistaken, I'm already booked for all of my one-on-ones. I actually have to go back and open up some spots because I'm pretty sure that's already booked. But there are still spots for my NCLEX review, and I promise I'm going to go back in that calendar and open up my one-on-one tutoring sessions as well. So I promise more coming. Now, if you watch part 1, I already told you guys in part 1, if you guys hear some noise, please don't mind that distraction. That's my kids going in and out. I'm out of town. I'm here for a soccer tournament, but I'm so proud of my baby. We got to the semifinals. We won. So we are going to the finals. So the kids are having a ball here at the hotel room. So if you hear craziness in the background temporarily, that's what's going on. Please forgive me. Now, I think there was something else did I finish everything I want to talk to you about? I think I did. Okay, so let's get started, guys. We're going to start with feeding a sick child. Look what it says. It says, make meal times pleasant. You want to avoid any procedures immediately before or after eating and make certain the child is rested and pain-free. All of these things can disrupt that enjoyment of the child actually having a meal, and that may make the child not even want to have a meal. You don't want to give them an injection or perform some type of unpleasant procedure immediately before the meal because they're not going to want to eat. They're too busy being upset and crying. And you don't want to do it immediately after meal because guess what they're going to do? They're going to cry to the point that they vomit everything that was in their stomach. So that's why you don't do it immediately before or immediately after. And you want to make sure that they're rested and they're pain-free so that they eat appropriately. You want to serve small, frequent meals rather than large meals. Guys, remember, large meals, it can make the patient feel, nauseous. It may give them a tummy ache. They'll want to vomit. You always want to give small, frequent meals. And remember, the child in the hospital, most likely, they're going to be on medications. They're going to be getting IV meds that most meds have a side effect of nausea by itself alone, right? We don't want to make that worse. So you want to make sure you give small, frequent meals. You want to provide finger foods for young children. Remember, the job of the child is to play. Playing is how they learn about their environment. So you don't want to give them a meal where they have to just sit the whole time. Kids are not good at sitting still, right? So you want to give them finger foods so they can have more flexibility in their movements while they eat. Involve children in food selection and preparation when possible. So here's what you do. You want to give them a sense of independence. You want to give them a sense of autonomy. So you don't say to the child, what would you like to eat? You don't ask them that open-ended question because you'll be waiting forever. What you do is give them 2 or 3 possible choices. That way you limit the choices so you're not waiting forever, but they still get that feeling of autonomy. You want to provide food selections that are favorites of most children, such as peanut butter and jelly sandwiches, hot dogs. By the way, the hot dogs, be very careful if it's a small child. Instead of the hot dog being cut in that circular form, make sure you cut in like in just triangles. So if the hot dog accidentally gets stuck in their throat, they're still their airway is not completely occluded because it's not a circle, it's a triangle. So some air can still get through their airway while you're calling for help. Anything that's circular, you always want to cut in a triangle or an angle just to make sure if it accidentally gets stuck in their throat, their airway's not completely occluded. Other favorite foods: macaroni and cheese, pizza, spaghetti, tacos, fried chicken, corn, fruit yogurt. Now, of course, guys, depending on the patient's diagnosis, for example, if they've got celiac disease or something else, they may not eat those type of foods. So you really have to put that into consideration in the context of the test question that you're given. Avoid foods that are highly seasoned, have strong odors, or are mixed together unless typical of cultural practices. Typically, kids do not like to eat foods that are mixed. And when I say foods that are mixed, I'm talking about things like soup, where you have a whole bunch of, different foods in it, or pot pies. They don't like those type of foods. So unless the person comes from a cultural or ethnic background where they're used to those type of foods, avoid giving it to children because they really don't like to eat it. You want to provide fluid selections that are favorites of most children. And they give you examples. Whenever you're studying, guys, and you see the author in the textbook gives you examples, make sure you know those examples. Those examples usually pop up as select all that applies on your test. So what are those examples? Fruit punch, cola, ginger ale, sweet tea, flavored ice pop, sherbet, ice cream, milk, milkshakes, pudding, gelatin, clear broth, or cream soup. Offer nutritious snacks. Look at the examples, guys: frozen yogurt or pudding, ice cream, oatmeal, peanut butter, hot cocoa, cheese slices. Also, something you want to keep in mind: make sure the child doesn't have any allergies to these foods before you offer them. Make sure you're always checking in the patient's chart and you're looking at the allergies. Make the food attractive and different. Look at some examples. Using a cookie cutter to shape the sandwich. Serving fluids through brightly colored and unusually shaped straws. Slicing sandwiches into fingers. Cutting apples horizontally to make circles, but make sure you do it at an angle, guys. You do not want that throat occluded. Praise children for what they do eat, but look, I put a star next to this. This is very important. Do not punish children for not eating by removing their dessert or putting them to bed. Food should never be used as a punishment. Moving on to toys. Let me make this a little bit bigger for you guys. Look what it says. All objects within reach of children younger than 3 years of age should pass a choke tube test. So that's a toilet paper a toilet paper roll is a handy guide. If a toy or object fits into the cylinder, the cylinder of the paper toilet roll, if the toy can fit inside of that circle, those are items less than 1 1/4 inches across, or balls less than 1 3/4 inches in diameter, it's a potential choking danger to the child. So that toilet paper roll, any toy that can fit in the hole, right? Guess what? It can get lodged. It can get lodged in the pediatric child's throat. So it's not an appropriate toy to give to that child. Latex balloons. Latex balloons pose a serious threat to children of all ages. Why? If that balloon breaks, the child might put that piece of latex in their mouth, and guess what? If it's aspirated, swallowed, latex is very hard to remove, and that patient can start choking. It's going to be very hard to get rid of it. So latex balloons are a no-no for the hospitalized child. Latex balloons should never, ever, 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 ever be permitted in the hospital setting. Let's move on to fall precautions. My kids are doing good, guys. I threatened them not to come in here and they actually listened this time. Good job. All right, let's talk about fall precautions for the patient in the hospital. Prevention of a fall, Prevention of fall requires alterations in the environment, including, so these are a list of things that you really need to be paying attention to as a nurse. Keeping the bed in the lowest position with the brakes locked and the side rails up. Placing the call bell within reach and teaching the patient, if you got to get up for any reason, press the button. Teach a parent or the caregiver the same thing. If they need to get up, the child needs help, do not let them get up by themselves. Offer toileting on a regular basis so they don't try to get up to go to the bathroom by themselves, especially if that patient's taking a laxative or diuretic. Keep the lights on at all times, including dim lights while the patient's sleeping. Make sure that those wheels are always locked. Keep the floor clean and free of clutter. If they just mop the floor, make sure there's a wet floor sign next to the bed. Use a gait belt during ambulation. Patients who've been right here. Patients who've been lying in bed need to get up slowly. Why? Because they've been lying in bed for a while. If they get up quickly, they can have orthostatic hypotension. That blood pressure can drop very quickly. They can pass out and be on the floor before you know it. So you're going to teach them to get up slowly. You're going to teach them to dangle their legs, sitting on the side of the bed before standing. You're going to teach them to dangle. The nurse also needs to educate family members about the following. Look at this. Call the nursing staff for assistance. Do not allow patients to get up independently. They cannot get up by themselves. Keep the side rails of the crib up or bed up whenever patient is in the crib or the bed. The side rails have to be up. Do not leave the infants on the day bed. Put them in the crib with the side rails what? Up. When all family members have to leave the bedside, which means the patient's going to be by themselves, they need to notify the staff. They need to let the staff know, hey, we're leaving. This patient's going to be by themselves. They have to notify the staff and ensure that the patient is in bed or crib with the side rails what? Up. And call bell within reach if appropriate. And guys, that is it for feeding the hospitalized patient, toys for the hospitalized patient, and fall precautions for the hospitalized patient. So guys, part 3 is coming soon. I just can't say when because I'm going to be out here for 2 more days and my days are just packed. So I'm really squeezing this video in. I tried my best and I'm going to try to make another video by tomorrow or within 2 days, but I really can't make any promises because I'm supposed to be on vacation, but here I am making this video for you guys. Anyway, thank you so much for watching this video, guys. Please, in the comment section, let me know what you thought about this video. Let me know if there's anything you guys would like to see me cover in the future. Unfortunately, I'm telling you now, the next video is going to be part 3 because the only book I brought with me on this trip was this Peds book. So you're definitely going to get a part 3 next. But anything else, let me know in the comment section what you'd like to see me cover. Don't forget, I have one-on-one tutoring sessions. If all of them are booked, I'm going to have some open very soon. I also have NCLEX reviews that you can book and audio lessons that you can purchase. All of this can be found on my website, nexusnursinginstitute.com. Almost daily, you can find me covering a variety of nursing topics on my other social media platforms, such as TikTok, Instagram, and Facebook. Guys, thank you so much for watching this video. You guys will catch me on the next video.